we met with the commissioning doctors last afternoon on some of the outstanding issues around health, and we make the point all the time that the catchment area for what they call the acute centre of Queen's is growing, right? There's more pressure on it, right? So what is the rationale for closing A&Es in this North East London area, right? Because, you know, and if you look at what they call the CQC, their reports into the A&E acute at Queen's basically tell the same story every time now. That function is not working. Now, what is the point, therefore, of closing other A&Es will put more pressure on the A&E function that isn't working even by the government's own standards, right? Especially when the population's growing. And years ago, we were told that there's going to be all these different polyclinics all around the constituency, right? So you have what they call these integrated health centres, which take the pressure off Queen's A&E, right? And I think that's a good idea. You build little hospitals so that make sure that people don't need to go to hospitals. So we supported all these local polyclinics, and then they've stopped some of them being built. So all the pressure's growing on the Queen's A&E, whilst they're closing other A&Es, or still proposing to, and not build what they call these intermediary facilities. So again, it's an ongoing fight we have with the Department of Health. The trouble is, the Department of Health then abolished the primary care trusts and all the other local areas where you can have these discussions. So they centralised power in NHS England, and funny enough, they don't respond to this very quickly. So we're on this continuous row with them about building new integrated health centres. We've been onto them twice in the last 2 weeks about new doctor services in Rainham, actually, because they were promised for 15 years a new health centre over there, and that didn't get built. You know, on Dagenham and Rainham, opposite the tube station on the old Man and Baker site, we've had a row with them for 10 years about getting a new health centre in there. It was promised, and then mysteriously disappeared, on and off, and all of this. Now, when these things don't get built, again, this is not rocket science. People are going to go to the A&E, and the A&E is underperforming, and then they're going to close other A&Es. So this is another row that I have, right? And it is frustrating because people know that you can't get a what's it into a pipe pipe. You know what I mean? You can't, you know.
Because he's vibrating the condition.
Hold on. They are closing one of the private services within the Broad Street Health Centre, right? But we met with the CCG about this, and they promised to deliver a better service in there. And the real issue is not about closing services per se, it's about changing the nature of the service within it. But I take your point, there is a concern, because people now worry all around, they're thinking they're closing services